Hello, everyone. Welcome back to St. Louis Teens. We are honored to have with us today Dr. Joanne Carter, who is the Executive Director of Results, an international advocacy organization working to end poverty. Dr. Carter, you work with congressional allies, partner organizations, and technical agencies orchestrating U.S. and international campaigns to tackle major diseases of poverty, increase access to education, and expand economic opportunity for the poorest. Under your leadership, Results has grown as a movement of passionate, committed, everyday people with chapters and grassroots volunteers in every state in the U.S. Dr. Carter, we thank you for your phenomenal leadership in efforts to end poverty and for being here with us today. Dr. Carter, can you tell us a little bit more about yourself and what inspired you to become an advocate for those fighting poverty?
First, I just want to say it's great to join you, and it's really an honor to be here. I so appreciate the work that you're doing to mobilize folks and to get the word out on these issues. So great to be with you. So I'd say I was thinking about this, and I started doing political advocacy for social justice issues when I was about 14. I went door to door for a presidential candidate when I was 15, worked for a number of candidates in college, and we'll talk more about this later, but I think at the time I never realized that even beyond elections, like we had such power to influence the political process and really shape what Congress did, but I was always active. But I also really love science and medicine, so I actually started my career as a veterinarian. So I went to vet school. While I was a veterinary student, I had the chance to spend a summer in a vet school in India. When I graduated veterinary school, I visited veterinary schools, research centers in East and West Africa. But I think at that point, because I thought about working overseas, but at that point I decided, at least for me, the way that I could make the biggest impact on poverty was changing the policies in my own government. And then I was lucky enough to discover Results at a World Food Day event at Columbia University. And I first got involved with Results as a volunteer, and it showed me how to get involved at that deeper level, building a relationship with my own member of Congress. First, I was a local volunteer in the New York City area. Then I helped organize chapters in the whole Northeast. And then I got so passionate about the work, I left being a vet, moved down to Washington to lead Results work on Capitol Hill with Congress, and I've never looked back. And I would just say I've never found a place where I felt like I could make a bigger difference.
And Dr. Carter, you have done so much great work with Results, and Results has done so much great work. So I know it can be difficult, but if you had to sort of share with us some of your most favorite moments of advocacy work and work with Results, what would they be?
Yeah, it's a great question. The first really memorable moment I would say I have is when I was a volunteer with Results. So before I was on staff. And my own member of Congress was a senior Republican on the Foreign Affairs Committee and really influential. And he'd actually introduced a key bill with Results. And Results had organized a journalists conference call with him, with journalists from all over the US, and his staff wasn't around and he was back at his local office. So they asked me to come and, sit there to kind of support him and backstop him. And in preparation, I wrote all these notes about trying to think what the journalists could ask so I would be kind of ready to help him out. And I sat there, and as these journalists asked questions, and he was getting ready to answer them, I literally passed him my notes, and he would take a quick look at it and kind of nod his head, and then he would use my notes to answer the journalists literally from all over the country. And it just shifted my perspective about my own agency and the fact that I could influence these things. And it really wasn't, and that I could help this guy be a champion because he cared about the issue, but he didn't know everything about it, even have time. So, and I realized for myself, it was just that I was willing to do it. And so that was one of the things that I think shifted me to even make the decision to go on full time. And then when I was thinking about just other moments, the local Results folks in Ohio, in Northern Ohio, had worked for a while and had a really good relationship with their congressman at that time, Congressman Sherrod Brown, and had built a relationship. And then I had the chance to meet him. Results really wanted, and I passionately wanted, to take on the issue of tuberculosis because it was an issue that mostly impacted people living in poverty. It was mostly ignored because of who was impacted, which is people living in poverty, both in this country and around the world. And it was actually a driver of pushing people into poverty, millions of people. And when we started working on this, the US was spending less than $1 million a year to fight TB internationally. So I had the chance to meet with Congressman Brown then, because of the relationship the volunteers had when I was in Washington as on staff. And we asked him to take on this issue. And he said, you know, my dad used to be a doctor, and I remember when the TB clinic closed, you know, in my hometown, and I thought it was all gone. I had no idea. And he became a champion on that issue, and has stayed a champion for 2 years now as a senior senator from Ohio. And as a result, that funding's gone from like less than $1 million a year to over $500 million. And so seeing again what's possible in these issues, sometimes people are more than willing to be a champion, but they don't know about it if you don't ask them. So.
And Results has been instrumental in helping pass several pieces of legislation to combat poverty in our country and across the world. In your opinion, what are some of the monumental policies that we have successfully passed to end poverty, and what are some of the great milestones we have achieved in terms of ending poverty?
Yeah, thanks for that question too. One issue I thought about that you don't hear much about, but has had an enormous impact on the lives of millions of people and millions of kids around the world, and that's the issue of user fees. So fees for health services, especially for people living in low-income countries and people living in poverty, and also school fees. So when I started doing this work, in so many places in the world, public school was not free, that there are actually, even for public primary school, there were actually school fees that families needed to pay. And the consequence of that is that it impoverished families further, and they would also make the choice of like which of their kids got to go to school and who didn't. And it was very often the girls who didn't get to go to school at all. So, and the World Bank at that time, this was several decades ago, had really sort of pushed these policies. And these most marginalized kids and most, kids in the most impoverished families were not only kept out of school, but almost invisible because of these barriers. So we worked with, at that time, Nancy Pelosi, who was was on the committee that oversees the foreign aid budget, and other colleagues in Congress, and got them to insert legislation that said the US representatives to these international institutions couldn't support any loan or agreement that went forward that included those kind of school fees. And the consequences of that was it actually helped push the World Bank to reverse their policy on school fees and really push over time for the abolition of those fees. At least for primary schools, there's still a lot of places where kids do have to pay fees for secondary school. And that fundamentally meant that millions and millions more kids could go to school. So it's kind of a quiet story, but one that you don't hear too much. And it was really from a clever way that we worked with Congress, and that Congress put this language in that really shifted those policies, helped shift them around the world. Another, I think, really huge impact that we had, and again, work that we've done for almost 20 years is, as you may be well aware, 2 decades ago, where HIV/AIDS was decimating not just millions of lives, but whole communities and societies, particularly in sub-Saharan Africa, but many other places as well. And I have friends from that time who would literally go to funerals almost every day. And a friend who said he started doing this work on HIV to fight HIV full time because he was living in Zambia, and in the capital Lusaka, the fastest growing business was building coffins. And at that time, only a few thousand people in low-income countries had access to HIV treatment, even though that treatment did exist. But it was too expensive and it wasn't available. And people said, it maybe didn't even make sense to make it available. But, we worked in a bipartisan way to create something called the Global Fund to Fight AIDS, Tuberculosis, and Malaria. And we advocated for scaling up funding. And that program, along with investments that the US made and the President's AIDS initiative, have meant that we've gone from a few thousand people having access to AIDS treatment to over 25 million. And the Global Fund, in its work on those diseases, has saved like 38 million lives. But I would also say a friend of mine who was the very first person who was brave enough to go public on his AIDS status in Zambia told this story. It was actually when he was meeting with a member of Congress. It really moved me. And the member of Congress said, like, how is our work, how has our investment changed things? And he said, my friend Winston said, now when I go to my village, I go back to visit people, if I don't see someone, I ask where they are. And he just kind of stopped and you had to think about it. But what he meant was now, he said, now if I don't see somebody, I think they're at school or they're visiting family somewhere else. 15 years ago, 10 years ago, if I didn't see someone, I just assumed they had died of HIV/AIDS. And so it was about the whole transformation almost of a whole society and their expectations. So, I see that the things that we have helped do, we certainly didn't do it alone, but we played a key part, have literally put us on the path to end those epidemics of HIV/AIDS, TB, malaria, have reduced the number of people living in extreme poverty from, 1 in 3 to 1 in 10. And we can talk some more later about, some of the impacts that COVID has had on that, but massive progress, massive progress.
And Results leads advocacy campaigns to create more equitable policies and drive billions of dollars of government investment toward the highest impact solutions to poverty, which are vital for our country. And sometimes the biggest pushbacks to these essential policies is labeled under budget restraints. How can we effectively show the true value of these investments, be it in healthcare or education?
Yeah, it is something we hit up against, and I think there's a number of ways. It's a great question. I think there's a number of ways to look at it. I think one is impact in the world, because I would just say across the political spectrum, I have really seen when people can see the impact of some of these issues, it can really shift their thinking about it. And there's probably maybe no better example than the work we've done around child health, or what we would call at that time child survival. We have reduced child deaths by nearly 2/3 in the last 30 years. And we could see, again, as with HIV/AIDS, tuberculosis, and malaria, we could see our way to ending preventable child deaths in the world in the next decade. And that was not a given. When 30 years ago, when Results volunteers were working on this issue, there were over 40,000 children, 40,000 under the age of 5, who died every day. So that's a child dying every 2 seconds. And shortly around that time, a conservative Republican congressman from Alabama named Sonny Callahan took over as the chair, the head of the committee that oversaw the whole foreign aid budget. And before he came on board, he had never voted for a foreign aid bill before. He never voted for the bill at all. But we and our advocates and allies helped mobilize some of his Republican colleagues to encourage him to take on this issue of child survival and to see the impact that he could have on this. And he did. And I think it's because he saw the remarkable impact that things like vaccines and vitamin A given to a kid a couple of times in a year, or dollars worth of antibiotics, or other things that you could do to really save kids' lives. And he, and again, Nancy Pelosi, about as far apart politically as two people could be, actually created and expanded a child survival account in the foreign aid budget that has protected and expanded those programs for several decades. And when he left that, he retired and he left that committee, he said the single issue that made the biggest difference to him, that mattered most to him, was child survival. And now we've seen that expanded by billions of dollars. And again, that 40,000 a day number has dropped by more than half, almost 2/3, at a time when population has also grown. And I think when you see that kind of impact, sometimes that can help the budget constraints to disappear. I would also say, just in addition to impact, just policymakers understanding the need. As an organization, we've long focused on how do we address the underlying causes of poverty, because it isn't just about the amount of money in your pocket, but the basic human rights and our basic human needs. And in the case of the US, the housing crisis is a powerful example of that. And as you are well aware, COVID's only made that dramatically worse. whether we have a safe place that we can call home, it affects our health, nutrition, education, economic mobility, mental health, all of that. And yet, even before this pandemic, there was not a single county in the United States where somebody earning a minimum wage can afford to live in a modest 2-bedroom apartment. Nowhere. And beyond families struggling to find somewhere to live in the first place, many others manage to hold on to their housing only because they skimp on food or they can't pay the electric bill. The author Matthew Desmond has said, the rent eats first. And, the numbers look even worse when we look at who the affordable housing crisis really affects the most. Because home ownership is the single largest driver of this country's racial wealth divide, where the median wealth for white families in this country is 9 times that of Black families. And decades of discriminatory policy, have gotten us there, from redlining and segregation to predatory lending and all kinds of other policies. So in the last 25 years, the gap in home ownership between Black and white families has actually gotten worse, not better. And housing is just one of those areas. So I think engaging policymakers where they know some of these issues really are issues for their constituents, but making them more aware of not only the potential impacts of these investments, but just how sorely they are needed. And then I guess the last thing I would just say is, I do think there's a way that healthcare, education, all these needs, from my perspective, are rights, in a just, humane society. And there is also a fundamental way, I think, that we are all harmed, when some of us don't have our basic needs met, when people are oppressed based on, any range of race or ethnicity or caste or gender or sexual orientation or perceived disability. And so in some ways, I think really that shared understanding of how this impacts all of us. And then I guess finally, I would say, I hope in a way that isn't about closing our borders to people, for health risks, but to really understand that in a time of a global pandemic, that we need a global response and that everybody is affected. And we also need an equitable response that protects everybody here, because if we're not all protected, then we really truly are, all at risk.
And you talked about earlier how 2 people who may have totally different beliefs, such as Senator Pelosi and Senator Callahan, were able to come together on some of these bills. And in our current political climate, it is so difficult for an advocacy or political organization to remain bipartisan. And Results has done a phenomenal job of being bipartisan and welcoming people of all political beliefs and all backgrounds. Dr. Carter, what are some of the steps you take in order to maintain bipartisanship? And what are some of the hurdles that you have to overcome in order to remain bipartisan?
Yeah, a really, really important question at this moment. I would just go back to the basics. At the core, the Results model is about constituent advocacy, which means, you and me, and we advocate to the person who represents us. And whether, that can be whether you voted for that person or not, whether you agree with them on everything, they do represent you. And that is a huge opportunity, frankly, to influence the political process. The Congressional Management Foundation, which is a foundation that looks at these issues, and they ask congressional staff, and they ask them anonymously, so they hope they would kind of give candid answers about what impacts members of Congress to make a decision. And they said the single biggest influence on members of Congress who have not made a decision on an issue, have not made up their mind, it's not a paid lobbyist in Washington, D.C. It's a face-to-face meeting, or now, Zoom meetings, but with constituents. And particularly when people care about these issues, when they can tell stories, when they can make the case why it matters. So that building relationships, and working across the political spectrum to make that kind of progress has always been our focus. And it's really about a commitment to engage with everyone, and also not assume when we start that we know where somebody stands on every issue, and not write people off. And I think about even at a city or regional level, we see how important that is, right? Take your area, St. Louis, the area is represented by both Republicans and Democrats in the House. And as you know, our volunteers work with all of them, not because of their party, but because they represent the city and the state, and it makes them accountable to the people who live there. And it creates opportunities to leverage action and political change. So, we have some volunteers in places that are all Republican, some all Democrat, and places where there's a mix. But I would say, in this divisive moment, it is more important than ever, almost no matter where you sit on the political spectrum or where your representatives might sit, to work to find common ground. It doesn't mean that you win everybody over on everything, but it means that you might. And that really is what effective advocacy is about. If we have a moment, there's another story. One of our longtime advocates in Salt Lake City, again, years ago, went to meet with his newly elected senator. Senator's name was Bob Bennett, and encouraging him to be a champion on the issue of microfinance against small loans and other kind of financial services, particularly for women living in severe poverty. And they work closely together. So Scott Leckman, who as a longtime Results volunteer leader, and Senator Bennett, they work closely together through Senator Bennett's first term. And then actually in going into his second term, Scott decided to run for Senate as a Democrat. He was asked to run against Senator Bennett. So not only were they from different political parties, they were literally campaign opponents, but it was a very respectful campaign. Scott lost, and they picked right up back where they were, and kind of kept going. And it allowed Senator Bennett to make a huge difference in the world on the issue of microfinance, and in no small part thanks to him, funding for that program more than doubled. So I think we just never know, honestly, what's possible unless we attempt it, and our own power just as constituents with our members of Congress.
And I think those stories are just so heartwarming to know that people who were, so different and even ran against each other are able to work together so well and really come together for the better positive benefit, of our society.
Yeah.
And right now, we are at the unique crossroads of an epidemic, an anti-racism movement, and a presidential election. How do you think we can leverage this election time to accelerate and promote positive change?
Yeah, I mean, that is the hope of this moment. That's what emerges from this moment and gives me great hope in the face of difficulties that nobody wanted. First, the Black Lives Matter movement, the anti-racism movement, and the demand for racial justice and racial equity, with lots more people woken up, lots more people engaged, and also seeing the disproportionate impact of COVID's both health and economic harm, on Black people, on Indigenous people, on other people of color, has made it clearer than ever that first, that we will end poverty only by ending oppression, and that we have to make racial equity a centerpiece of all the policies that we pursue. So it's got to be the lens through which we look at all of these policies. So I think there is great hope in the kind of power of this movement and this moment. And, many people knew this because they lived it, but lots of people, including lots of policymakers who were not as aware of this, who where a light has been shown on some of these things. And I also think the need to respond to COVID, both economically and health-wise, at a scale that starts to match the huge challenges, right? I mean, the health needs, economic devastation, it kind of forces us to be more ambitious than we would have been before COVID. Again, nobody wanted that, but, we're talking about doubling, or in some cases, tripling of food insecurity in this country. We're talking about the World Bank warning that 100 million more people by next year, could be 150 million more people around the world pushed into very extreme poverty. The World Food Program, seeing hunger worldwide could double. So all of those, the scale of that challenge, I think in a way has pushed Congress to have to respond in a new way. So the old baseline for what was enough and what was acceptable, I think, has to kind of change a bit. And even with the very tragic meltdown of the last few months around a COVID, emergency response, I still think it's changing. And that we know that we need to mobilize trillions of dollars in the face of this. And, it can't just be about going back to what we had, but rebuilding something different and better and reimagining that. And, we did see, even earlier in the summer that some of those political constraints did disappear a bit. You talked about like, how do you break through when people say that there are budget constraints? And yet we saw they mobilize trillions of dollars. And I think we will see that again post-election. Plus I think we've never seen the world more focused maybe on global public health. And I hope and believe that the Black Lives Matter mobilization has also, again, profoundly shown a bright light on these profound racial inequities that have long been here, but have too often been ignored by lots of people, including lots of people on Capitol Hill. So I think there is just real hope that these can be drivers of change. And, the last thing I'd say is, at a time when a lot of people are overwhelmed by COVID and also mobilizing for the election, we have seen more interest in results and more people wanting to come in than I've ever seen before. And I think that will only increase post-election. And so I think it's really an exciting moment when people have felt mobilized for an election, but also I think there's this great chance to say like, okay, when the election is over, it is still up to us to define the scale of the response, the racial equity of that response, and we can really shape that. And that's the choice we have starting, in the first 100 days of a new Congress and an administration. So I think it's a really hard moment, but it's also a really powerful, exciting moment. And I think it could be a moment of sort of profound change.
And looking into that interest in results and the advocates of results, Results is one of the very few organizations that welcomes youth and teens into advocacy and helps them build strong partnerships with their members of Congress. Dr. Carter, what are some of your memorable moments of working with youth and advocacy?
Well, I mean, I'd start by this moment right now. The remarkable advocates like you in the St. Louis area, your work in the media, getting the attention of Congress. It is the model for the kind of advocacy that's needed in this country, by young leaders, but at any age. So that inspires me. And I would just say there's so many stories of young people, young leaders making such a remarkable difference on Capitol Hill. One of my favorites is a few years ago, an advocate named Garrett, who joined Results when he was 19. And he joined our youth leadership training program for young adults, and he and a handful of others in Eastern Kansas started calling and writing both of their Kansas senators about a critical piece of legislation on women and children's health globally. And in trying to get through, Garrett decided to take the next step. He wrote an op-ed on the bill. A few weeks later, that got published in his local paper, small paper, but an important one to his senator. He then showed up at the public town hall with Kansas Senator Jerry Moran, and in the handshake line, he handed the senator a copy of his op-ed and his contact information. And then he tells the story, like a few weeks later, it was New Year's Eve, he gets a call on his cell phone, and it's his senator. Wow. And his senator calls him and says he was inspired by the op-ed, he wanted to meet with the group, and a month later, he was a co-sponsor on this bill. And then a few weeks later, after that, the other senator, Senator Roberts of Kansas, also added his name to the bill with his staff emailing Garrett and saying it was the op-ed and also the letters that he'd gotten from Garrett and these other young results leaders. And I would just say, like, literally nobody in Washington, D.C., who was a legislative expert, would have put those, particularly put those Republican senators on the top of a list of likely co-sponsors on this bill. But in a matter of months, they were. And it wasn't, a major donor or a big lobbyist. It was a 19-year-old who was persistent and smart in his advocacy and really committed to building that relationship and getting the work done, getting published in his daily paper, again, a small paper in a town, but one that mattered for Senator, and then doing the work to connect and build that relationship. And this kind of a crew of young advocates at universities in Kansas that have kept up that support and pressure over the last 5 years. So working across the aisle. So that's just a story for me of just both what's possible and just really smart advocacy where a few really committed people can leverage big things.
And Dr. Carter, what would your message be to teens during these difficult times? And how can we be better prepared, be change makers, and be a part of the solution?
I guess what I want to, my biggest message is, is not that you are the leaders of tomorrow, that you are among the most effective, powerful leaders the country has right now. And we really need you. And, we aren't, I don't mean that we collectively are putting all of this on your shoulders, but the country and the world really does need you right now. And if you are willing to use your voices to engage with members of Congress, engage with the media, you can literally move billions of dollars and change policies that will change millions of lives in this country and around the world. And that power really is, it's in our hands, it's in your hands. So I just say, you're some of the most powerful leaders right at this moment, and we really need you, and your voices matter. So I'm just grateful to get to have this dialogue with you.
Dr. Carter, we thank you so much for leading our advocates and our country in our efforts to end poverty through policy. And we thank you for your service, for your time today, and answering all of our questions.
Yeah, it's been great to be with you. Keep up the amazing work that you're doing. And I think this can be, it's going to be work, but I think this can be a transformational moment. So I look forward to continuing to work with you.